Constipation to me would be going days up to weeks without having a bowel movement. It's painful, it's uncomfortable. It's not the most fun issue to go through, but that's what it is to me. Throughout many, many years, I have gone through vigorous testing to figure out what's causing my constipation, what solutions there are, and I've sort of gotten the runaround through each physician I've seen where they just say you need to eat healthy, you need to exercise, and eat more fiber. The hardest thing I guess would just not finding the solution, and whether it's natural or whether it's a medication that I take. Just the hardest part would be having gone so long without specific answers.
Today, let's talk about your bowel movements, or as my daughter says, let's talk about your poop. Constipation is a very frequent problem, with up to 30% of Americans really suffering from this condition. There are many misconceptions about constipation, but what is constipation? Now, constipation is defined as having fewer than 3 bowel movements per week with straining, hard stool, or incomplete evacuation. I live and practice in Detroit, and I believe our city and the people that live here represent the best of America. I wanted to create a place that folks can go to that not only delivers health information, but also helps us share inspirational stories to help all of us grow, with real problems discussed in depth with real solutions. You are the most important person to the patient. This is Ask Dr. Nandi.
So there would be times where I'd be in a lot of pain, where I wouldn't go to events or go hang out with my friends because I was just sick. I didn't feel well at all.
Welcome back. Thanks for staying with us. We now have on our show Christina Oulette. Christina, thank you for being here.
Nice to meet you.
I appreciate it. Same here. Tell the audience here and at home a little bit about yourself so we know a little bit more about you.
I'm 25 and I live local to the area as well. I first heard about coming onto the show through a posting, and you were looking for a person to come on with dealing with constipation.
Okay.
And I'm thinking, why would I want to go on television talking about such a fun problem that I have? But it's something I suffered for many years.
And maybe we can help some people who've had the same problem you have.
Exactly.
So, how long have you had constipation?
It's honestly something I've dealt with for many, many years, as long as I can remember.
Like as a kid, like let's say when you're in grade school, I mean, really, your entire life?
I've never been regular, if you will, whatever. I don't know what regular is really.
Okay.
It's something I've really dealt with for a long time.
And tell me, as a kid, so you never knew what quote unquote normal should have been. How did you feel? I mean, did it affect your life at all as a kid? Because you didn't know.
I think I just grew used to it in a way. I would have abdominal pain. I'd complain to my mom, and she was very homeopathic growing up, and so she'd have certain remedies, or give me a certain tea, or.
Did that work?
I felt like it did, as I was growing up, in some respects.
Yeah.
But I think she had more control over it then than now that I'm an adult. Finding new ways to control it has been kind of an issue.
And then when you let me go back to when your mom was giving you, did you use it often? Did you use teas a lot, or?
I would say maybe on a weekly basis.
Okay, and then because you wouldn't go for a whole week probably then. Important to know at home. It's okay to use it occasionally, but some of these teas and some of these liquids are called natural, and they're considered, but they could actually have a stimulant laxative within them, and then what happens is that your bowel becomes dependent on them, and then without that you really can't do anything at all, and you can't really use any medicine. So be careful. Just because it says natural tea or natural solution doesn't really mean that it doesn't have an active product that could really affect your colon. So important when you're at home. Before you were diagnosed, besides what your mom gave, what did you use to help with your relief of constipation?
As I grew older,
How old were we talking about? Like in teenager?
I would say
or?
I was probably in high school.
Okay.
I really recognized it to be an issue. And I would start to exercise a lot, drink plenty of water. I changed my diet. I started eating as natural and raw and organic as I could, incorporating lots of fiber into my diet. And before I started really educating myself through doctors, which was a challenge in its own to find the right solution in that.
And when you did, you ate a little bit more healthy and you ate more natural, did it help?
I would say a little bit. Not until 4 years ago, I quit eating red meat.
Okay.
And I just stayed really close to eating natural chicken and fish, and I felt like that helped quite a bit.
Do you drink a lot of water or fluid?
I try to as much as I can. I mean, there's times where I catch myself not drinking as much as I should.
Yeah.
But I would say more than often I do keep hydrated.
And it's tough to talk about this with anybody, It's like nobody really wants to hear about.
Sure, right.
I didn't have a bowel movement, but what did you do? I mean, before talking to a doctor, did you talk to anybody about it? Your mom, maybe?
Yeah, just close family, I guess. I didn't really verbalize it as much as I'm as open with it now. It's just my issue, and it's what I deal with. But no, I don't really feel like I shared it with too many people.
And then how about when you were a teenager? Did it affect your life very much? I mean, there's stuff that you couldn't go to, or do you, like when you had to have an event, you felt bloated or uncomfortable? Did that happen?
Well, at times it would. I actually, through my whole childhood, I struggled with a lot of weight gain and weight loss and going up and down, and I had really bad acne as a child, and I feel like that could have been a part of it as well, just containing all of that, toxic junk inside of you, makes your appearance. You get a little more self-conscious than I think normal, but bloating for sure.
How much of your life, did it stop you from doing anything ever? Or did it make you more self-conscious?
I think it would just, I wouldn't say that I stopped doing things because of it. I learned to work around it. I would have a really bad stomach ache, so there would be times where I'd be in a lot of pain, where I wouldn't go to events or go hang out with my friends because I was just sick. I didn't feel well at all.
And what would you tell your friends?
I just
don't feel good?
Just don't feel good.
And they
stomach ache or...
What do they ever say? Do they ever tell you that you have a lot of stomach aches? What's going on? Do they ever ask you?
Well, even now, at home or with my friends, I'll just like, oh gosh, my stomach hurts, and it's almost like a recurrence all the time. Like, I'm so sick of saying my stomach hurts all the time.
Yeah, I bet they are too, because they want to do things with you and you can't.
It's like, go do something about it. So it's been interesting for sure.
Important points, Christina's making is that, when you have this problem, when you don't have trouble with constipation, you think, how could this really affect your life? It's just going to the bathroom. But what happens is, many times, people who have this problem, it can be such a big part of your life that it stops you from doing things. People even pick jobs. I mean, it didn't happen to you, but people even pick jobs because some places you can't go to the bathroom very easily. If you're driving a UPS truck, you can't do that because if you're that bloated and you have to go when you can, it's important. So we'll come back and talk again with Christina about constipation. Please don't go away.
And I went through a time where I went 2 weeks without having a bowel movement.
Oh wow,
and
2 weeks.
2 weeks.
Welcome back. Thanks for staying with us. We were talking with Christina and her experience with constipation. Christina, do you remember when you were diagnosed?
Going through many different types of testing, I think it took a while to find the actual diagnosis, if you will. Yeah. I would say I was probably in the middle school.
Oh, that early?
And then I was reevaluated again after I graduated high school.
What did they do? Well, how did they diagnose you? You're in middle school, what do you mean? You're a kid?
Sure. Then I was doing more, I would say, I've had MRIs, I've had
MRIs, okay.
I've had X-rays for it, and this is when it wasn't as invasive as my later testing was. Ultrasounds to try and see what's going on within my system.
All negative. Mm-hmm. Okay. Did you ever have a colonoscopy done? Mm-hmm.
Yep.
When was that?
That was after high school. I think I was 19 years old.
Okay.
I was in a lot of pain, and this was right before I quit eating red meat. And I went through a time where I went 2 weeks without having a bowel movement.
Oh, wow.
And
2 weeks.
2 weeks. I was freaked out, and I said, I was trying everything. I was taking laxatives even during this time, and I did not have a bowel movement. I'm like, this is not normal, And
no new medications at that time, just nothing?
No, I've really never been on any study medications. And I first had a colonic before the colonoscopy to just, at that point, I couldn't wait to get all of this stuff out, everything I've eaten for over the last 2 weeks out of my system.
It must have freaked you out.
It did. It was really, really painful. So my mom knew of a
Yeah, the people who do colonics.
Yes.
Yeah, absolutely. Yeah, there's a long name for it, I'm sure.
Exactly.
Yeah.
Thank you. And so I went to see her and got instant relief from that. But I later, about 2 months later, I realized I really need to start getting some answers or testing and figure out what's going on. So it's when I
had the colonoscopy.
Exactly.
And then what did they find? Anything at all?
No, actually. They said it came back completely normal and that I should just go on my everyday normal life feeling fine. And there's no reason I should be constipated or have so much abdominal pain. And I'm like, well, to me, that was a very lazy answer. I'm obviously coming to you with a problem.
And that's an important point she made. And so, you go through a lifetime. Obviously, this is a chronic condition for her. And I think it was appropriate that, you had a change where you didn't go for 2 weeks straight. There's something going on. And it's appropriate to have a colonoscopy done, even though you're young, to find out exactly what's going on. You may not be looking for cancer, but could there be something structural, something inside your colon? But an important point she made was that, after all that, said, oh, you know what, we don't know, and that's all there is. It's important when you have this kind of problem that you have to be proactive and you say, listen, I'm not getting the answer that I want. And so you have to find somebody that really can do that. And it's not always easy because you may be in a community where there's not that many doctors or specialists, but you have to give yourself that option that if you're not getting the solution, we've talked about this many times on previous shows, if you're not getting the option, the real treatment, they're not addressing what you need, you have to be able to find somebody else. What did they recommend? Any treatment at all?
No, to be completely honest.
What did they
just sent me on
water,
my way. Well, they after the point that I really started changing my diet, starting to exercise and quit eating red meat, I went back. It's still having the same issues. So they recommended eat healthy, drink water, and take more fiber. I'm thinking, there's no possible way I could consume more fiber or eat. I guess I could become a vegan. I'll eat healthier that way and go completely raw. But I was at the point where I was, having very well-rounded meals that were very
and
healthy.
Still nothing happened.
No. And that was the answer I was getting. Eat healthy,
Fiber,
exercise, fiber. And I'm thinking.
Did you ever think they didn't believe that you were eating healthy?
Yeah.
Yeah. This is an important, again, this happens all the time. People, who have this chronic constipation, they eat healthy, they're doing everything right, but it doesn't work. And there could be more. And that's when you have to really see a specialist and see, is there something else that you could do to make this better? And so it's not always just the diet.
Sure. How
How long before that you finally had some resolution? Did you ever see anybody that helped you more?
After getting so many, just do what you're doing, you'll be fine. I was like, okay, being proactive, I was like, I have to find something on my own then at this point in time.
Yeah,
because
absolutely, you had no choice.
I had no choice. So I went down to a local nutrition store and found a supplement. It's called Constipation Stop, again, being natural and holistic and all those things. But it does provide relief. And I was so sick of, like you said before, your body becomes so dependent on a laxative if you're taking it. So I quit taking harsh laxatives, and they were hurting me more than helping anyway. So I found this a lighter solution that I to this day actually still take a couple times a week if it gets really bad. Otherwise,
can you
I
go
can
without
months.
taking it? Go to the bathroom?
Maybe a couple times a month I can go without it.
So you still need that?
Mm-hmm.
Okay.
I would say I do. There's a few times, during the month that on a monthly basis, let's say I'll go twice on my own. It'll be like 2 weeks before I'll need to take the Constipation Stop. But I've done digestive enzymes, I've done stool softeners.
Everything. Everything. Well, again, an important point is what I agree with is that she advocated for herself. I mean, with information that you have now, you can try to get the best treatment for yourself. I'm not sure this product you're talking about, what it really has in it, but at least, what Christina did was, so I'm going to at least try to advocate for myself, get some relief. Be careful when you take products like you're talking about, read the ingredients, because even though it says natural, they may have stimulant laxatives that really could affect your colon. So, but I really want to thank you for sharing your experiences with us so more people can understand what it's like. So when we come back, we'll have Latrice Banks, our registered dietitian. Please don't go away. And what do you think, it seems like it's occurring more and more. What do you think we as Americans are doing to make this worse? Why are we suffering more from this? Welcome back. Thank you for staying with us. We now have our favorite registered dietitian, Latrice. Latrice, thank you for coming again.
Thank you. My pleasure for being back here again.
Well, we're talking about constipation today. And how common, it seems like it's the most common digestive complaint in America. How common is it, in your practice when you see people? How commonly do you see that?
Very common. I wouldn't say half, but a good third of my patients. Now remember, I work in 2 different healthcare settings.
Right.
So first, in the hospital setting, we see a lot of patients who complain about it. But the interesting thing is they only think that not being able to go, like I have to go, I'm trying to go today, but I can't go, and that's it. Not the infrequency of the bowel movements as a problem.
But have difficulty going, in other
Right.
words. Okay.
Yeah, just difficulty going, not necessarily not being able to go.
That's interesting.
Yeah, a few times per week.
And we talked about, I'm sorry to interrupt you, but we talked about that in the beginning of the show, is that everybody thinks that it's just not going.
Right.
It's the incomplete evacuation or difficulty going, even if it's normal, right? So.
Yeah, and they'll tell me, well, when I went a few days ago, it was fine.
Yeah.
Oh, when I go, I can go, but not that when I try not to go. Yeah, you understand?
Got it.
Yeah.
Absolutely.
And so then, conversely, in long-term care setting, we have, the elderly.
Yes.
And with them, they are
debilitated.
Yes, physically inactive, so they're chronic pain medications. So they're frequent users of stool softeners and laxatives. But it's still happening.
It's very different for them because they can't really go at all.
Exactly.
They're not saying that I can go and I can't go. It's difficult for me to go. They just can't go at all.
Exactly.
So it's 2 different types of treatment. Important, again, we have such misconceptions about constipation. First of all, people just blow off constipation. When somebody says I'm constipated, it's kind of a ha-ha, oh, you're constipated. But it's a big problem. So we talked about a couple of things that are important. Latrice brought those up. Is the incomplete evacuation. I can go, it's normal stool, but it doesn't seem like I really go properly. The second is the traditional definition. I'm not going very frequently at all. And what do you think? It seems like it's occurring more and more. What do you think we as Americans are doing to make this worse? Why are we suffering more from this?
We love convenience. That's the problem. So our diets are filled with convenient foods.
Yes.
So for example, we love fast food or ready-to-eat foods or ready when I want them foods, basically. Yeah. Yes. So what that means, if you take a combo meal, your typical combo meal, you break it down. You have your white bun, your burger, maybe 1 leaf of lettuce, a few slices of tomatoes, cheese, mayo, maybe onions, fries. Top it off with a sugar. Yes. Top it off with a sugary drink or a caffeinated drink, and you got yourself a pretty low fiber meal. Continue that, and there's your low fiber diet.
Right.
So
absolutely.
That's the biggest problem, and we need to really make a change with that. The other thing is being physically inactive. We know that regular exercise really helps to keep your bowel regularity in check, and so the more you move,
Exactly.
Basically.
Exactly.
Yes.
Perfect. Important points we brought up here. Number 1 is the convenience of America. Everything is fast. Give it to me now. I want to prepare my food. And if I have a choice, I'll just have something that's right there in front of me, and they're starch filled and and very low fiber and no vegetables. So that sets us up. Now, what about fiber? Is all fiber the same, and is there any differences in fiber? What do you think?
Yes, we have 2, soluble and insoluble fiber. So the first one, soluble fiber, I like to coin it that slide you out fiber because it forms a gel in the gut and allows your waste to
slides out. I like that.
Move on out. It's great because, you know, it works as a sponge. It collects the bad stuff. Your bad cholesterol moves that out of the body, and it really helps that stool to not be so hard. So you can find that in your sweet potatoes, your pears, flax seeds, oats, your oatmeal. Those are great sources of soluble fiber.
Your vegetables too, probably, right?
Yes, your vegetables, your fruit. Now, the other type, insoluble fiber, it's more of your roughage. You know, it helps to build bulk in that stool, and that's going to help you to stay regular or a consistent pattern of bowel movements.
So you got to have a combination of both of them.
You have to have a combination of both of them. So you're going to find that one in bran, in your nuts, and your seeds, and beans too.
I love nuts.
But beans has a combination of both of them. So those are
soluble fibers as well.
Yes.
So important points. We talked about fiber. We talk about it as a general topic, but you have to remember the soluble and insoluble fiber, and both are important. And try to have sources of both types of fiber so you can not only get yourself going, but you can protect yourself from certain disorders as well. Now, what total amount of fiber should people have in general, if you men and women, would you say?
Now, men, and it varies with age also. So men 19 to 50, that age group needs about 38 grams, and that's a minimum. And men over 50 need a little bit less, 30 grams. Now, women, of course, we always need just a little bit less than men, 25 grams for those in 1950 age group.
Okay.
And then about 21 grams of fiber for those over 50.
And you can combine those with insoluble and soluble and put that together, right? Mm-hmm. And so most Americans, you know, you gave those numbers, are far from that. Oh, yes. I mean, sometimes about half of what we really need are what we actually intake, you know, and it's a multiple number of things. You know, we are always on the go as well. You know, no time to prepare foods, and so we have lots of excuses. And the bottom line is, if you do that, we continue on with this problem. And there are other things you can do, meaning that there are other hereditary conditions or structural, but if you try to stick with the dietary conditions, if the dietary advice, I think you can do a lot of good. When we come back, more with Latrice Banks. Please don't go away.
A lot of people aimlessly eat anyway, so let's just throw
that would be me.
So let's just throw some extra fruits and veggies in there to snack on, and you'll see those total fiber numbers go up.
Welcome back. You know, we've been talking with Latrice Banks and how we can really treat and affect constipation. Latrice, when we left, we talked about the total amount of fiber that men and women have. You were talking. Any tips on what types of foods maybe you can give the people here and at home?
One good tip is add fiber to every meal. So find ways. So breakfast, lunch, dinner, you can always have fruit. Lunch and dinner, because most people do not eat vegetables at breakfast, but lunch and dinner, making sure that you add some color to your plate or color to your sandwich or to your salad. And, you know, one thing I tell my patients, do not allow just that one little corner pocket on your plate to have the vegetables. Let your vegetables and fruit rule the plate, and that's going to be more fiber. And they have fewer calories too, so you get a double benefit from it.
Yeah, and so then that fills you up, and let your vegetables rule your plate. That's nice. Mm-hmm. And another thing I tell a lot of my patients, they tell me, I have this total intake, should I supplement? And I tell them, if you can, as much as possible, include it in your diet, because if you include it in your diet, it makes it that much easier. Would you agree?
I totally agree. And you can always throw it in between meals, and a lot of people aimlessly eat anyway, so let's just throw
that would be me.
So let's just throw some extra fruits and veggies in there to snack on, and you'll see those total fiber numbers go up.
And if you do that, now what about total fluid intake? We talked about fiber. Let's say you just do everything right with fiber, but really have no fluid intake. Does that help your body as much?
Now that is key, because as you are increasing your fiber intake, you do not want to become dehydrated or have bloating from not taking enough fluids. So typically you want to stick with around 2 liters or 8 cups a day.
Okay.
Now that can increase. It is really based on your weight, but that's a good standard.
Like an 8-ounce cup?
Yeah, 8-ounce cup, and have 8 of those a day, basically. But the key here is all fluids are not created equal. So water is best, always. Make that your primary source of hydration. And then, a lot of patients like to drink, or a lot of people like to drink juice. My recommendations for that always has been eat your fruit instead of drinking your fruit. Okay,
That's a good
if
point.
you want to get your fiber, you need to eat it, chew it. Takes a longer time to process. Give that brain time to register that, hey, I'm eating, I'm going to get full. So go back to water first.
Yeah.
Milk you can slide in there too.
Sure.
And limit the added sugars, you know,
And carbonated products as well.
Carbonated, definitely. You know, your carbonated beverages and caffeinated beverages, they will dehydrate you.
Exactly.
Yes.
This is the opposite.
Yes.
Now, so important points that she brought up, you know, that if you have fiber and you're really doing everything you can about fiber, but yet you don't have the amount of water you really need of the fluid, it's not going to be helpful. It's actually going to be detrimental. You'll feel bloated, uncomfortable. And one of the number one problem that most people with constipation they have is the feeling of bloating and being uncomfortable all the time. You heard Christina talk about the pain that you have. So if you ignore the fluid content, then that is meaningless for you. The second thing is that if you're going to have fruit juices, carbonated beverages, try to have water first. And I like that. She said, you know what? If you're going to have fruit, eat your fruit, don't drink it. And now people blend everything together. What do you think about that? When people just take all their vegetables and pummel it together. There used to be that guy with the longest eyebrows in the world, I think, used to advertise that. You just blend every fruit. I mean, what do you think about that? Does that help at all?
It can, but you want to make sure you have a high quality, not blender, but food processor or juicer that's going to collect the pulp and the skin and things like that from the fruit also and the vegetables. Because otherwise, if you ever, read the label of a fruit juice that was natural, just freshly blended, it still has like no
fiber. You're absolutely right. No fiber,
No.
because you remove all that stuff out. So it's important. Now, we've heard about laxatives. What's your opinion about laxatives and the role of constipation? I mean, we talked about basically changing your diet, but some people need more. What do you think about that?
Laxatives, they're okay to use temporarily, but you do not want to rely on them, of course. And just like any other digestive disorder, you really want to adjust your lifestyle first, not being reliant on something else, unless you just can't help it.
Of course.
In some cases, but the majority of the cases can be managed with lifestyle change through changing your diet, slowly increasing that fiber intake and increasing that fluid intake.
Exactly.
And physical activity.
Yeah, that's so important, the physical activity. We'll talk about the laxatives. Laxatives, people, the biggest problem I have is there are a lot of natural laxatives. And people know, I think, that if there's store brand that says laxative, maybe there'll be a problem. But when they put it in a tea or some drink or a powder and it says natural on it, people say, oh, it can't be bad. Certain antibiotics are natural. So, just because it's natural doesn't mean it's not going to harm you. And secondly, a key thing Latrice said, it's okay for the temporary relief of constipation. If you haven't gone, Christina talked about you haven't gone for 2 weeks, you're not going to sit there and not use anything at all. Sure, it's okay, but when it becomes that you're dependent on it, then it becomes a problem. And so what you would like to do is use as much as you can with your dietary changes, the fiber, the water, and then if you're really not having any solution, then you can use laxative. If you're having to use laxatives, very important, if you're having to use laxatives, on a regular basis, you need to see somebody. And that you need to see a specialist, because sometimes a general doctor may not be enough. Latrice, thank you for all those helpful hints on diet and fiber and fluid intake. I really appreciate it. So when we come back, we'll have questions from our studio audience. Please don't go away.
Why do pain medications cause constipation?
Welcome back. Thanks for staying with us. We now have some questions from our studio audience. Latrice, it's we've been talking about constipation, so hopefully we get some good ones here. Huh?
Yeah.
All right. Yeah, yes, sir. First
Hello,
question.
Dr. Nandi. What is the difference between chronic constipation and irritable bowel syndrome?
Well, that's a very good question. The question is that if you have irritable bowel syndrome, there can be two types. One can be with diarrhea and one can be with constipation. And so really, what's the difference between saying chronic constipation and irritable bowel syndrome? It's part of a spectrum. What happens is that some can just have constipation with no abdominal pain or no bloating. And then once you start to have bloating and discomfort and pain with the bowel movement, or which gets better with bowel movement, then goes towards irritable bowel syndrome. It's just a matter of how much pain, how much discomfort is involved. Both, again, like we talked about, involves difficulty in either going, with the number of times a day, or number of times per week, we talked about less than 3 bowel movements per week before, or that you can't really go as much as you want, meaning that going with incomplete evacuation. And so it's part of a continuum with the treatments really in the beginning the same. We talked about our dietary fiber, talked about our fluid, try with that, but with chronic constipation and with irritable bowel syndrome, you may need medicines actually with help with some of the symptoms. Latrice, what do you think?
So the difference between these two is definitely the type of treatment. Now it does depend on which type of irritable bowel syndrome symptoms that
So diarrhea or constipation, obviously.
Exactly.
Okay. Okay.
So we know that with diarrhea, soluble fiber helps because it helps to control those spastic movements of the gut that's happening. But we also know that with insoluble fiber, it can really worsen the constipation. So we want to really...
And then they increase the bloating as well, right?
Yes, the bloating and the discomfort.
And that's the main problem with IBS.
But with either one of those, fluid intake is still consistent. Making sure that you have adequate fluids, avoiding caffeinated drinks, carbonated beverages, and the like. So in a sense, they do have the same treatment, but when it comes to diarrhea, it does vary just a little.
Absolutely. And the point also is that if you have more irritable bowel syndrome, you often need something else besides just the diet or the fluid intake that'll make a difference. Next question, sir.
Dr. Nandi, what are stimulant laxatives and why are they bad for you?
That's a great question because people don't often know what's the difference. So stimulant laxatives are laxatives that actually force your colon to actually have a movement. There's other types of laxatives like osmotic laxatives that you basically take, and what they do is they help the bowel movements occur without having the colon muscle actually move. So stimulant laxatives are laxatives like senna laxative, the cascara laxatives, and what they do is they actually help the colon actually move, which occasionally, we talked about that before. Occasionally it's fine, but then when you take it on a regular basis, then what's happening is that you're basically having your colon more prone to depend on it. And then you have like a lazy bowel, and then you can't move without it, despite what your diet is. So we try to avoid stimulant laxatives as much as possible and have the non-stimulant laxatives. Latrice, what do you think?
Yes, and that's very prevalent in long-term care setting. We see a lot of our residents that are consistently on stimulant laxatives, and they do develop a lazy gut, and so what happens then is you kind of just worsen the problem. They end up being impacted, or you have to change to another type. But otherwise, it's a very common problem that's happening.
And it goes towards your comment. What Latrice said before was that we're just a very convenience-oriented society. Mm-hmm. You take a stimulant laxative, you may get effect right away, whereas if you take other types of laxatives, or if you try to work with your diet, it's much harder. So with a stimulant laxative, you may get a result much quicker, but if you use it on a chronic basis, it can really cause some damage, and then you won't be able to really affect the treatment any other way. Next question, sir.
Dr. Nandi, why do pain medications cause constipation?
Again, a great question, especially in chronic care settings, in hospital settings or nursing homes, really important. And pain medicines, as we all probably know, is they go towards the opiate class of pain medicines. If you're taking Tylenol or something else that's non-narcotic, it's not as much of a problem. But if you have a narcotic, it slows down the gut. Mm-hmm. And if you slow down the gut, then what happens is that your bowel movement number goes down, and your stool, the number of the bowel movements and stool that you have is decreased. So then you have more bloating and discomfort. And what happens is we tell people that are taking narcotics. This is also very common, not just with patients in chronic care settings, but you had surgery. You have a back surgery or had some hip surgery, and you're in pain, and you're given a narcotic, and this can develop pretty quickly. So what do you think? You practice in some of those settings. Do you see that?
Exactly. The point I was going to make was it affects all age groups. I mean, you have young adults, older adults, or middle-aged adults that are dependent on pain medications at the procedure or for any type of problem that they've had chronically, and it can create a vicious cycle.
It does. You're absolutely right.
And what we'll see is sometimes they have to resort to using enemas while they're in the hospital or at home, and then the pain comes back. And you take the pain medications and you're stopped up again, and then you have to do the whole cycle again. So it is,
it's a vicious cycle. You're absolutely right. And as a gastroenterologist in the hospital, a lot of my consultations that people have people come and see me for is that they have had a surgery, they've been on narcotics, and now they can't go to the point where they're in the hospital for a few more days because they can't, I mean, they're so uncomfortable. Their major problem is really solved, but because of the narcotics, that they can't really have a bowel movement, they're bloated, they're uncomfortable. So really important point. I think if they're starting to take narcotics, give them all the cues, really be careful about the diet, and then I think that we can try to thwart off this constipation. We have to take a break. When we come back, we'll have more from our studio audience.
Yes, how often is it necessary to have a bowel movement to be considered healthy or normal?
Welcome back. We've been talking about constipation, and we had some questions from our studio audience. Latrice, the last one, pain medications really can be a real problem. So, next question. Yes, sir.
Yes, Dr. Nandi. I've heard that colonics can be helpful with constipation and can decrease the toxins in the body. Is this true?
All the poisons and everything else that's there. Yeah, that's a great question. Latrice, what do you think about that? What about colonics?
Again, like with anything, you do not want to use it consistently. It is great to use, periodically to get a great cleaning. However, with anything, you have to build other habits. We do not want to rely on these, not artificial, but these ancillary, options as your way of treating constipation. We really don't want to do that, because what I find with most patients, they'll go and have this and they'll continue eating a poor diet. And we know that those high-fat diets, they really can slow down your digestion. That extra fat, it takes longer to get through the digestive tract, and that's usually the problem that can cause this condition to worsen. And
first and foremost, try to go to the dietary techniques and water. Absolutely. Colonics, colonics, celebrities use it. I think there was an episode, Kim Kardashian went in and they showed a colonic, or one of her sisters that could not believe that was on TV, and they showed it. So for those of you who are at home who have never seen a colonic or know what that is, you actually insert a tube in your rectum, and then you fill that rectum with some water and sometimes with herbs to get it going. And it can help for some people. I mean, Christina talked about when she was really desperate, when she hadn't gone for 2 weeks. Yeah, it's a measure that's occasional, and that's fine. It's exactly what you said. When it starts becoming that you have to have a colonic in order for you to have a bowel movement, it's a problem. The other myth is that there are no real poisons in your colon. People say, my colon's coated with poison and it's going to really take over. There's no real poison in your colon. It's stool, and stool is a normal part, physiologic part of your intestines. So these commercials and these claims are really false when they say there's all these toxins, you've got to remove them, and you do, everything's going to be solved. It's not really the case, because your body, by itself can remove the stool, and it's not a toxin. It's a way that you can actually, your body's normal way of defecation. So that's one myth about these colonics. There's really no poisons. Second is that, if you start using this on a regular basis, again, just like the stimulant laxatives, you become dependent, and you need enemas to go, because your body is then used to that stimulation in order for you to go. Also to mention, you're going in these places, there's no guarantee that it's completely sterile, and you have to worry about infections. And we talked about C. diff, we talked about all these infections in previous episodes. You want to be careful. And so there are many reasons why you shouldn't be using colonics as a way to get rid of your constipation, or a way to release toxins. I think occasionally, if you really need to, I would even avoid it occasionally, but if you need to and you're in a position like Christina was, absolutely. But as a chronic problem solver for constipation, I would say absolutely not. Stick to your fiber, stick to your water, do your regimen, and then if you're really stuck, perhaps and looking at it as one of the measures. Next question. Yes, sir.
Hi. Is having a colonoscopy a useful way to find the cause of constipation?
Well, that's a great question. So, looking inside the colon, is that going to help to find a cause for it? Great question. And Christina talked about, the fact that she has been constipated most of her life, and she finally had a colonoscopy when she had a great change in her bowel movements. Colonoscopy, it's a bit controversial. Not everybody needs a colonoscopy. If you're someone who really doesn't have any risk factors for colon cancer and you've had a good evaluation, you may not need a colonoscopy. A colonoscopy is important when you have something that's new, something that's changed, or if you're an elderly person, to look for structural changes, meaning that there's something inside your colon that's causing it not to be able to go. So I think a colonoscopy is useful, but it's not for everybody. What do you think, Latrice?
So in the case if the colonoscopy is necessary, absolutely, in most cases it's not. Once you've gone in there and you had things evaluated.
And it's negative and there's no real problem,
right,
yeah.
No structural changes, no structural problems, then go back to square one. Start evaluating other things, evaluating your diet, evaluating your fluid intake, and adding more physical activity, those things. And then you may have to just go and see another specialist because there may be another problem that's causing this that you're just not aware of.
Exactly. Great points. Next question, please. Yes, sir.
Yes, how often is it necessary to have a bowel movement to be considered healthy or normal?
Yeah, it's a great question because people really don't know. They think if you don't go every day, there are people that come and see me and says, I haven't gone in 2 days, there's got to be a problem. And the key is that it varies depending on the individual. There's no absolute number, right? So, it depends on the individual. What I tell my patients is that when you start having symptoms, your body will tell you, meaning that when you have some bloating or discomfort, and, in general, if you're not going, more than or equal to about 3 bowel movements a week, then you should think about it. But otherwise, there are people who go 3 times a day and have no problems, and others who, you go every other day or once, every 3 days on a regular basis without a problem. And that's the key, is that you have to define it for yourself, and it's individualized. So, really great question. Latrice, I want to thank you for coming again and giving us all kinds of great advice. And also Christina, thank her for coming and sharing her experience. When we come back, Partha's Prescriptions, please don't go away. Welcome back. Thanks for staying with us. Today, we've discussed a very common problem in America. What can we take away on today's Partha's Prescriptions? Number 1, maintain a healthy diet with high fiber and increased fluid intake. This will help to prevent constipation. Number 2, if you suffer from persistent constipation, see your doctor for treatment. Be proactive in finding a solution. Thirdly, in treating constipation, avoid using stimulant laxatives. Let your doctor guide you in the correct use of medications to help with constipation. Lastly, become educated with the side effects of your medicines and supplements. They can be the cause of your constipation. For more information on constipation or an archive of our previous topics, please visit our website at www.askdrnandi.com and join in on the discussion at our Facebook and Twitter pages. Just search Ask Dr. Nandi. Lastly, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you. And that word is namaste. So namaste to each and every one of you. Thank you.